May I get your attention, please? I hope you all had a refreshing tea break. Without further ado, let's begin our second scientific session. I feel truly honored to host our distinguished speakers who will enlighten us with their insights today. In today's world, digital platforms have transformed how we learn and practice. This session highlights how to effectively utilize online resources to enhance surgical training and expand learning beyond physical boundaries. To begin with, may I request Dr. Atul Kamath to kindly grace the dais and share his insights with us.
Change. Okay, yeah. Good morning, everybody. At the onset, I would like to thank all the organizing members of AJHRC Institute of Medical Sciences for giving me this opportunity to speak on at today's CME. And I'm Dr. Atul Kamath, and I'll be talking on online and internet-based surgical training and on to how to maximize this digital resources. So walk in time. So if you go 100 years back, this was how a surgery was taught. You can see that a surgeon is performing on a patient and so many people are just watching it like it's a theater movie, right? Probably the name operation theater would have come from this particular place where the surgeon is standing, operating on a person, and so many people are just watching it and gaining their experience and trying to learn something from this particular surgery. So then slowly there was a shift to the digital age. Probably because of these three things, probably because of technological advancements, globalization of education, and obviously 5 years back, which we had the COVID pandemic, it was an eye-opener for us where we came to realize that digital learning is much more easier and safer to learn when such things occur. So in the traditional surgical training, initially we had this in-person mentorship where you used to apply to a particular doctor. He used to see your CV, he used to look at you, and then he used to call you, you go to him, you work with him, and you gain your experience. Then came the OR experience where you go to the OT, you observe the surgeon operating, and then you gain your experience from those particular places. Finally came the cadaver labs where you used to learn on the cadavers and gain your experience. But the limitations were geographic barriers. You had to go to that particular place, spend time with that particular surgeon and learn, limited resources, and high cost. So then came this online collaborative learning, especially during the COVID-19 times, where global webinars, case discussions, and online conferences started, along with usage of interactive platforms like Zoom, Microsoft Teams, and WebEx. Many conferences went online, like AO webinars, SAGES conferences started going online. So why digital training? Not all surgeries begin with a scalpel, but some begin with a simulation. And the advantages of this would be accessibility across geographies. With the touch of your phone, you can attend a meeting that is going on in the United States. You can click on a link and attend a webinar which is going in Japan. So that's the reason this digital training is advantage. So the accessibility across geographies is taken care of, cost effective and scalable. With a lot of cheap internet packs which you have, with the internet accessibility, it's easy, scalable, and you can get this particular digital training possible. On-demand learning, you need not have a particular fixed time to read. Anytime whenever you are free, your time permits you, you can start learning. Safe environment for skill practice, and you can have a standardized curriculum delivery where it is standardized and you can learn, especially in BMJ and all, British Medical Journal, they have all these particular training programs which you can enroll, listen, and gain your experience. So in the key digital resources, you have these particular platforms. In the e-learning platforms, you have Coursera, Medscape, and Touch Surgery. In the virtual reality and augmented reality, you have the immersive simulation for surgical procedures, video libraries and live streamings on YouTube, WebSurge, and OR Live. And of course, all the websites have now come out with their own apps on Android and iPhone, which are compatible. So you just need to download their apps, keep it updating every time, and you can have a seamless access of all their material. And then artificial intelligence and simulation tools, where personalized learning, error detection and feedback is possible with these particular tools. So in ophthalmology, you have all these particular places, especially the first one is Indian Journal of Ophthalmology. Once upon a time, it was only hard copies which are available. Of late, IGO is gone almost online, and they are asking people to subscribe if you want a hard copy. Otherwise, it's going to be online anymore. The second one is the Hack State module, which is a simulation module which is conducted by AJHRC, and it is going across the countries or across the European nations, where they are training surgeons or the young ophthalmologists to gain their skills. So that is the Hack State module which is going on in the second image. Third one is obviously the Alcon Experience Academy, where you have this digital learning series, where it covers a vast series of videos, right from patient counseling, creating a tunnel, steps of the surgery, how to take care of a toric IOL, what are the things that you need to do, IOL biometry, everything is being covered in this particular digital series. And the good part is they keep on adding new videos every time and they keep it updated. And finally is the Asia Pacific Glaucoma Society, which is again has its own popularity, and it has its app where you can download and you can get updated. So the best thing for the residents here would be to enroll and subscribe all these particular platforms, because once you're a resident, everything is free, and they give you a minimum of 3 to 5 years of subscription when you're a resident. The minute you finish your residency and you have a degree, then you have to pay for all these things, and it goes in dollars. So the best time would be in residency when you're a second year or third year. Subscribe, be a part of it. For 5 years, you can have all the accessibility, gain your knowledge, practice, and then you can come out of it. So APGS, ESRS all have 5 years of subscription. The minute you get your degree, your hands are tied, then you can't, you have to pay in dollars especially. So in popular platforms, you have IC Surgical, which are VR-based phaco and vitreoretinal surgical stimulators. Cyberside by Orbis is again one more great place where there are free online courses. Almost, I think, once in 2 weeks, Cyberside conducts their own webinars. You just need to subscribe. They just need an email ID, right? And they'll give you all the latest webinars which you can observe. Then there is telemonitoring. AAO1 network is one more good place where you have high quality video library and clinical cases. iTube is one more place. It's just like the YouTube of ophthalmology, where all the surgeons just need to have a profile and you can upload your videos on iTube, and it's a good place to learn again. Again, free subscription. iFocus is by AIOS, which you all know and has been discussed in the previous talks. It's an Indian platform for ophthalmic e-learning, and Help Me See, which is a simulation based, which is I think available in few centers across the country, where they give training for SICS. So augmented reality is the next thing that is coming up, where use of AR headsets like Microsoft HoloLens, which are used. And the advantage is overlaying anatomical structures are performed, real-time guidance is being given, and you can do remote proctoring. And the most important is you can practice repeatedly. You don't have a shortage of tissues, nothing like that. You do once, you have not performed it right, you can perform it one more time. And the best thing is it analyzes you and assesses you and gives you a score, whether it is good, bad, or worse. So you keep on repeating till you are perfect in this particular place. Yeah. So the benefits, as I told, repetitive practice, realistic procedural feedback, and measurable progress tracking can be done. And Alcon has come up with this new VR training called Fidelis, which will be gaining today in the afternoon. So this is again a VR simulation, which will be helpful for you in practicing, repeating, and gaining the finesse in this particular place. Now, what are the challenges? So limited access to high-speed internet in low resource areas. In Mangalore, I think you'll be able to get it. Probably you go 50 kilometers away from here, you may have some problem with the internet facilities. Technological learning curves. So myself, I'm not sure whether VR, because I have not tried VR, so using a VR, probably I need to get used to it and then train people. So technological learning curves is there. That's the second part. Lack of tactile feedback. Now in VR, you're doing it in the air or probably using the VR automated modules. But when it comes to the real eyes and to the tissues, again, handling could be slightly difficult, so that would be one more disadvantage. And obviously, ethical concerns in patient simulation. So what is the future that we see from here? So as far as I can see, integration of AI-driven tutors would be required, where you have a realistic approach, advances in that realistic field, and blockchain for credentializing and certifications. So once it is certified, you can have a standardized teaching method where if you have created that module or crossed that module, then you are on par with your peers. And hybrid models, would be more important, where combining online and in-person, because you just can't read from or learn from a robo, nor can you practice directly on patients. So a combined hybrid model where you learn online and then in-person training would be the best approach is what I feel in the future. So in conclusion, digital tools are enhancing but not replacing the traditional training. Accessibility and scalability are the limitations which, if taken care of, would be of good benefit for the people. And then ongoing innovation is essential for maintaining quality and safety. So technology will never replace great surgeons, but technology in the hands of great surgeons will change the world for you. So I hope all of you will come today, gain more practice experience, and most importantly, be confident in what you're practicing. Thank you so much.